Do you know which age group has the highest amount of unpaid medical bills? You might assume it's the elderly, but you'd be wrong. In fact, according to a PBS article, 27-year-olds on average carry the most medical debt per person. Keep in mind, someone who's 27 may be only 1 year off their parents' health insurance plan due to the Affordable Care Act, and yet their medical bills have already started to pile up. While millennials may be burdened by the hefty cost of health care, it's a nationwide problem affecting millions of people from all backgrounds. A 2017 Urban Institute report found that medical debt is the most common financial burden in the United States. And it's a hot topic for not only millions of Americans, but also those working in healthcare who find themselves in the middle of an inefficient system.
The issue is the billing war that's going on across the electronic medical record screens. On the one side of the war, we doctors are forced by the system to bill the most for the work we do. And it takes, as I say, all this time to click, 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 click all the time. On the other side of the screen is the insurance industry, a person there that's being forced to pay the least. We're trying to bill the most. They're trying to pay the least. And it's like any war, it's a war about money.
That's Samuel Shem, author of The House of God, and now Man's Fourth Best Hospital. In his latest book, Shem points out some of the negative effects of greater technology use in the industry, including an increased reliance on computer charting in recent years.
On every 8-hour shift for a resident in the hospital, all the hospitals in the United States, they do 8,000 to 10,000 clicks. They're there for 70 to 80% of their time. They're in front of screens, which means, if you include going to the bathroom and eating, they have about 8% of their time being with patients.
Shem is an MD himself and a professor at New York University Medical School. NYU is no stranger to forward-thinking innovations in medicine. In fact, it's the first completely free medical school in the country, thanks to a generous donation from an alum. While new medical technology makes up the forefront of state-of-the-art medicine, Shem says it's also gotten in the way of doctor-patient relationships.
It was a time when medicine could either go toward more humane care or toward money and screens, which means money and money, because what the public doesn't understand is that these computers are just billing machines, just money-making machines, cash registers, not for their care. And so it's a long answer to your question, but the biggest thing that has happened, certainly on the negative side, is the presence of money in medicine, and especially money that has to go through billing on computer screens, which is driving doctors and nurses crazy, which is making healthcare for people absolutely full of horrific events.
Sometimes the best way to create change isn't through breaking a few bones, but instead tickling someone's funny bone. At least that's one of Shem's prescriptions. Many people have told him how much they appreciate his candid perspective and use of satire in simplifying complex and sometimes intimidating topics.
The reason I write as a satirist and stuff is I see myself as writing fiction as resistance, which I didn't realize I was doing till many years after The House of God. And I think that I can't be a leader of a group, but I can be a reference and a thinker about what I really know that this is the way it has to go. What we got to get is what most other civilized countries have, which is a national health care, nonprofit, and a parallel for-profit thing that people can get. It's not rocket science, but it is kind of rocket science for me to suggest get the private billing out of the screens. You know how happy that would make doctors if they just could say, oh, this is what's wrong with this patient. I'm clicking these diagnoses in. That doesn't take much time. That's what we kind of used to do. But to go through all these, 20 clicks to write a prescription?
Despite the large amount of coverage around our broken healthcare system, the problems continue to mount. About 137 million Americans faced money issues due to medical costs in 2019, says NBC. The number one reason people consider taking money out of their retirement fund or file for personal bankruptcy are unpaid healthcare bills. So why are so many people struggling to keep up? Shem says one of the biggest contributors to the high cost of healthcare is the varying price nationally for the same procedure.
Clicking once on appendicitis as the diagnosis, okay, the code for the diagnosis. And then if we have a national healthcare system, it means that more or less every procedure all across the country is about the same billing, which is not what it is now.
Currently, prices vary from hospital to hospital, which can mean big differences in how much you owe. And if you've ever tried calling beforehand to figure out how much a procedure may cost, you'll know it can be a frustrating and lengthy phone call. And if you've ever tried calling beforehand to figure out how much a procedure may cost, you'll know it can be a frustrating and lengthy phone call that can end in fuzzy price estimates. With all of the challenges in healthcare and rising suicide rates among doctors and nurses, Shem tries to remind young people heading into the field why they're really there at the end of the day.
We doctors are the ones who are present at the most suffering moments of people's lives. And it's a gift to us. If we can be with them during that, they're not going to suffer as much. We are not going to suffer as much as, being in front of a computer, and everything will go better. So medicine is a gift. It's great to be able to help people. And this is why I went into it, because I wanted to be a writer as well. You can always get a job, a paying job, in the broad field of medicine, whether you're into rats and experiments or whether you're into countries. That's how broad it is. And I'd say there's no greater satisfaction than helping someone through their suffering, and that's our job.
However, much of the job these days has turned into piles of paperwork, which can get in the way of patient interactions, a focus that couldn't be more important in today's high-volume healthcare industry.
There's a lot more attempt to pay attention to the doctor-patient relationship, I think, but it's not working because we are exhausted and not burnt out, but abused by the electronic medical records and the insurance industry. And it's in many, many ways, it's driving doctors crazy. The overhead for a for-profit insurance is 33%. It just goes to administrative costs, all these hundreds of drones working to try to squeeze money out.
With Washington divided on solutions to fixing the healthcare system, only time will tell which way the country will head. To learn more about Samuel Shem, his book Man's Fourth Best Hospital, and the state of our medical situation, visit viewpointsradio.org. Also follow Viewpoints Radio on Twitter and Instagram for more behind the scenes. This segment is written and produced by Annie Krall and Amira Zaveri. Studio production by Jason Dickey. I'm Marty Peterson.
Viewpoints returns in just a moment.
Coming up next week.
The thing is, we don't really have to choose. We don't have to be like, oh, I'm either going to be really fit or I'm going to have desserts and not be fit.
Cutting sugar from your diet doesn't have to be as restrictive as many assume. Then,
most of the interviewers and most of the interviewer/photographers were white. And here these people were being asked by white people for the first time in their lives what they felt like, what they experienced.
We take a look at the intimate portraits of those formerly enslaved. I'm Marty Peterson.
and I'm Gary Price. These stories in depth on your public affairs magazine, Viewpoints.
And That's Viewpoints for this week. Viewpoints is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more about upcoming shows and find a library of past programs on Apple Podcasts, Google Play, and Spotify. Plus, you'll always find previous segments and more information about our guests at viewpointsradio.org. Join us again next week for another edition of Viewpoints.